who have surgery might come into you and they might have a cut like this right here, right? And if they have surgery, they're gonna have a pin that goes down the side of their finger. So from the top all the way down. So normally if they come in and they have a little incision right here, I'll touch them right on the tip of their finger like this. You should be able to feel that pin if you go like that. And they won't even like it when you tap them like this, because you'll be able to feel it if they have that pin. So doctor's gonna put them straight and put the pin straight through, so it's gonna cross the DIP, right? It does not cross the PIP, so you're allowed to do PIP motion, you're allowed to, once that wound heals, you know. So after surgery, you're doing, you know, wound closure if there's any. Usually it's pretty easy. You're doing scar massage, scar edema types of massage stuff. So simple, it's really easy. You just talk, you know, massage here, on the sides. I do the whole finger. I make sure the whole hand gets stretched this way to make sure they don't get like real tight flexors. I'm just trying to find something to do. I go into hyperextension, make sure that they're not tight, and you know, but it's just so easy. You don't need to do anything that first week, you know, come once or twice, depending on what they want. Usually your cash paying patients won't come that often. But your insurance, workers' comp and stuff like that might need to come a little bit more often, right? So workers' comp is like, you want to follow the doctor's order, one, and they also want to, you know, want to make the most out of the time that they get in therapy. So, but usually that, if it's commercial insurance, then you make your recommendation still the same. You're making the same recommendation. I think it's, you know, twice a week, once a week, you know, at the beginning, depending on their severity. So sometimes people have one and their whole hand is hurting. They should be coming to you a little bit more often. If they're like, no man, my hand's fine, it's just a pin, I don't even feel nothing, then okay, once a week just to follow up. And then when they, at 6 weeks, they get the pin removed, then you want to make sure that they're coming in often, because, and they know there is absolutely no passive range of motion to the DIP. They should still be wearing their splint, right? They should still be wearing their splint because you don't want that surgery to fall, because sometimes it'll fall. And what you're doing, you're monitoring, you're always monitoring that lag. You know, observed extensor lag at the eval. How much was it? Monitoring to make sure the extensor lag doesn't get worse over several weeks of time or whatever. And after after the pins are removed, no passive, but you can do active. You can do active, and then where is it greater than 10 weeks, you can start doing strengthening and all that stuff, and you can start passive range of motion there too, and then you can get rid of the splint. Right? That's it. Super easy, boring, and hard all at the same time. I had a guy who, poor kid. He had a saw injury, broke this, so he had pins sticking out. When you see one pin, it's an extensor issue. If you see one pin, it's an extensor issue. If you see 2 or more pins, it's a fracture. Do you know why? If you see 2 pins or more, there's a fracture. And it's because, you guys know how to make shish kebabs? Right? So when you put that shrimp or whatever on one shish kebab and you go to grill it, when you go to flip it, it's gonna rotate on that one skewer. If you put 2 skewers through it and you lay it down and then you flip it, that meat or shrimp or vegetable won't rotate, right? So when you have a fracture, they're gonna always minimum put 2 pins in. So one might be, depending on the fracture, the angle and stuff, you might see 1 pin this way and 1 pin this way. Or if it's a simple fracture, you'll see 2 pins going down like this. And that's so that the bone that's broken doesn't rotate on that 1 pin. So when you see 1 pin, oh, sorry, when like screw all of it. If you see 1 pin, and you see that little incision right there, most likely it's a terminal tendon type of issue. See 2 pins, it still can be a terminal tendon if you see that, but most likely there's a fracture involved as well.
Hey there, it's Huang. Thank you so much for watching my video. And if you found videos like this helpful for developing your skills, critical thinking, and just in general developing your career as an occupational therapist, then consider saving it for later and 2, sharing it with another therapy friend. Thanks again for watching.